Hello, good morning. Today we're going to talk about one of the most difficult and controversial topic regarding ADHD, and that's about whether we should use medicine to treat children with ADHD. This is undoubtedly one of the most difficult decisions that a parent has to make. While it's true that the struggles with ADHD is very real and unrelenting, but as we all know, the medicine that we use to treat ADHD, it's not a short-term solution. And it's not necessarily a long-term solution either. And there's no way that we're going to cure ADHD from using the medicine. This is very different from uh, using antibiotics to treat ear infection or pneumonia. It's more like using medicine to control asthma. Basically, when you take the medicine, you control the condition. When you stop taking the medicine, the condition reverts back to its uncontrolled state. But very differently from treating asthma, you always have a choice when it comes to treating ADHD because, as we all know, you can live with ADHD. You can survive with ADHD. It may not be a very easy life, but you can certainly do it. People have done it for millennium. Unlike treating asthma, where if you don't control your asthma, you can actually stop breathing and die. So there's always a choice. And for me, whether the choice to use a medicine is similar to whether you want to use uh, medicine to control your migraine. Because just like treating ADHD, you can survive with migraine. You may not be happy about it. Your life can be quite miserable if you have recurrent migraine attacks. But you can do it, you can live with it, even without pain medicine. And just like treating migraine, the medicine takes effect when you take the medicine. And when you don't take the medicine, well, the migraine happens. So I always emphasize this to the parents that the decision is always theirs to make. It's not just theirs. In fact, I always involve the child. A lot of times I present it to them as, well, imagine, for those of you who are familiar with Harry Potter, imagine there's a potion that Professor Snape can teach you. And this potion, once you take it, it can make it easier to get things done, to do homework, to study, to remember things. In a way, it does make you a better student and make your life a lot easier. So you can kind of go from being a Ron to a Hermione, just with a potion. They say, wow, that sounds too good to be true. Well, see, well, it's not fiction. There's actually a medicine that we do have. In fact, for the last only 70, 80 years, we have these medicine. Ritalin first came about to treating ADHD in the 50s. So, yeah, we have a lot of experience with these medicine. These are tried and true solutions. But at the end, they're short-term solutions. They would temporarily control your symptoms. They will allow you to focus better. But it comes with a price. Kind of like many of the potions in Harry Potter. It can be painful, it can make you nauseated, the effect may wear off, it can have side effects. So I will go in depth into the medication side effects in another video. But for now, I always want to emphasize that the decision whether to use medicine is a very personal one. So I never pressure parents or patients into taking the medicine. My job is to tell them what the medicine can do, how it can help you, and sometimes the effect can be quite transformative. And I've seen this over and over. But at the same time, the side effects are very real too. I do want to emphasize that None of the side effects are dangerous. None of the side effects are life-threatening. I've seen plenty of situations where people accidentally or unintentionally or intentionally take too much of the medicine. Instead of taking one a day, they end up taking 20 or 30, and they do end up in the emergency room. But I've never seen anyone die. The worst thing that happens is they got really jittery and they feel like they're really wired, and they may have a hard time sleeping that night. But that's basically it. The medicine is incredibly safe, fortunately. And the way the medicine works is that it works fast. After taking the medicine, it takes about an hour before the effect starts to take in. Unfortunately, when the beneficial effect starts, that's when the side effect starts also. So they kind of go hand in hand. Um, it is possible to experience the benefit of medicine without any side effects, but that's not very common. As I will talk about later, side effects are quite common. So just remember, the decision is always yours. And the nice thing about these medicines is that you can start and stop anytime. You don't have to gradually wean off the medicine. Basically, by the end of each day, the effective medicine is gone. So there's no build up or no need to build up the therapeutic dose in your body. And in fact, most of my families, they take the medicine only on school days. And in a few families, in a few patients, they actually only take it on the days where they have important exams. And that's totally fine with me. I'm very flexible. I work with family. I tell them that, you can stop the medicine. You don't have to have my permission to stop the medicine or restart it. But I do want to emphasize that if they ever want to increase the dosage, do let me know, because I don't want them to increase the dosage continuously without my awareness. All right, so that's a good introduction to medication, and most importantly, I explain my philosophy on using the medicine. The decision is always up to the family and the patient. It's a very patient-centric approach. Okay? All right. See you at next video. Have a wonderful day.